speaking of staff, I just want to acknowledge before we get started, I really want to acknowledge the people behind the scenes who put all of this together. You heard from Cohen Miles Rath, Josh Malatino Brown, Mary Lou Hedge, and of course our incredible Deputy Director Melissa Ramirez, who has been with us for over 16 years and leading the charge around the administrative piece of the work we do, among many other things. I also want to acknowledge my colleague, my partner in crime here, John Richter. John has been with us for 15 years, and John has been our public policy director, has done a wonderful job. When you talk about mental health education, John's been the guru in that for us for many, many years, and many other issues as well. And I'm so glad to continue to work with John and his leadership around public policy issues. As Bill said, this is, just counting, this is over 30 years now that MHANYS has been doing the legislative day in some kind of iteration. It's been mental health matters for the last number of years, but it's really, been a really, whether it's been a 2-day thing, a 2-hour thing, whatever iteration it's been, the issues might be a little different than they've been over 30 years. And hopefully things have gotten better for people's lives. But the foundation of the work that we do remains principled and mission driven, and the same it's been for many years. So our 26 affiliates in 52 counties around the state are really principled, and they're really about mission and the work that's being done. And I think that when you hear a mental health association across New York State, that they're representing quality, efficiency, compassion, and recovery. And recovery is the key principle of everything we do, that individuals recover, get better in their lives in the community with community supports. We know that, and that's been proven true time and time again. And the other thing we do at MHANYS, and our members have done for a long time, is we fight. We continue to fight the stigma of mental health related issues. That's what we do. That's a lot of the principles we stand behind. You're going to hear today, this morning, between the hours of 10 and 11, you're going to hear about some of those issues that are specific to the work that's being done, the priorities around the budget, and also about public awareness as well, because that's something we're very mindful of and something we're very engaged in over the years. So I'm very pleased to introduce our public policy director, John Richter, who's been a real leader for Legislative Day and for many other public policy issues over the years. John, the floor is yours.
Glenn, thank you, Bill, and thank you, Glenn, for that. Good morning, everybody. For those of you who have had the ability to join us on Legislative Day before the pandemic, this would be a part of the morning where Glenn and I would begin, and Bill would begin, and be in front of the podium up in front of all of you. And we would be kicking off a portion of the morning where we talk about each one of our issues. And the reason that we did that, it was an opportunity to educate folks on the issues that we were carrying, because in the afternoon, everybody would go off and visit their legislators and they'd be well prepared. So the purpose of this morning and going over the issues is still the same. Is to familiarize you with the issues, to prepare you, and then hopefully you will meet with your legislators, if not today, but in the future sometime. So we're still preparing folks to be fluent in MHANYS issues. And then the other thing that would happen right about now is I'd ask you to pull out a couple of folders. One would be a blue folder, and that would be your folder with all the information you needed for the day. And the other one would be a red folder, and that was a folder we'd ask you to give to your legislators. So naturally, we need to do things a little bit differently now. We still have prepared for you some documents that we hope you'll use as tools to familiarize yourself with the issues that we're talking about today, and to remind you of what those issues are. And I'm just going to show you where you can find those now. I think that Cohen is going to drop a link into the chat, and that's a link to our legislative action community. So I highly recommend you visiting the legislative action community. And there you'll find the various different documents that we prepared. And I'm going to attempt right now to show you what that looks like. And if you go to okay, so that's what the legislative action community page looks like. You can get there from the link that Cohen just sent. If you scroll down and you go back below MHANYS legislative briefing book, you'll see something called policy priorities. And if you click on that, this is kind of what I call a bit of a cheat sheet, because it's got all of our 6 issues that we're talking about today in one place with a brief explanation of what the issue is about. And also, as you can see in italic blue there, that's what we call our ask. That's what that's our recommendation to legislators. That's what we're asking for. That's what we want to happen. So this can be helpful to have with you as a quick reference guide. But for more in-depth view of each one of the issues, you can simply go over to here where it says issue briefs. And you can click on that, and all the issues that we're talking about have their own individual issue brief. Here's one for funding for nonprofit human service providers, which you'll be hearing about shortly. And basically the issue brief looks like this. There's a description of what the issue is about. That's to educate you. And then there's also the recommendation at the bottom. And you can use these for your own edification, but these are also useful to leave behind for your legislators. You could, for example, you could use this to craft your own letter, and please feel free to plagiarize it as much as you would like. And you could use this as an attachment to a letter that you write a legislator, or you can use it as a leave behind if you visit them in person. So those are some things that we've put together for you, some tools. Hope you find are helpful. We really do hope and encourage you to, if not today, again, try to see if you can't take an opportunity. Legislators are meeting with people. Some of them are meeting with people in person now. If you're not comfortable with that, most of the legislators are holding Zoom meetings, and they have been. So give their office a call and set up an appointment to talk to them. Don't be intimidated. Prepare yourself with the documents we have. Listen today, and we wish you the best of luck. So thanks, Glenn. I'm going to pass it back to you.
Thank you so much, John. And we're going to start off by talking about the first issue on our list, which is the top priority for this year. And it's and I said this at the budget hearing earlier this year. We're so used to talking about COLA as our top issue, and that an unfulfilled COLA, and that's kind of been the narrative for, frankly, most of the last 14 years. But Governor Hochul, who, by the way, spoke last year at this event, we were very pleased. First, she wasn't governor, the lieutenant governor, but still the first standing governor who's ever spoken at our event, and it just showed consistent commitment to our issues. So, Bill and I were going to talk a little bit about the COLA and the impact of the fact that we haven't gotten that 11 of the last 14 years. But just to sort of reiterate, kind of, we talked about the budget, and there have been good budget years in New York State before, over time. Obviously, this is a long history, but even in good budget years, mental health was never really positively impacted as it should have been. But this year, to Governor Hochul's credit, the executive budget is a very powerful budget. It needs more, of course, and needs more funding. We're here to talk about that. But the COLA, the 5.4% COLA, was a wonderful, obviously not enough, but it was a wonderful start. But she also provided funding for retention bonuses, 988 funding increase for $35 million, and I'm going to talk about that a little bit later, to $60 million, $65 million for housing, going to $104 million, $8 million specifically for the Dwyer funding, and the list goes on and on. Is a very positive budget, but more needs to be done. And that's the whole idea of why we're asking for $500 million more in the budget. The reality is, again, 11 of the last 14 years where there was a statutory COLA that was not funded, or it was funded minimally. As a result, with the math being done, that was over $500 million that was left at the table for mental health, for behavioral health. Think of how much different it would be now if there was that $500 million over the last 14 years. Think of the less deaths of despair by opioid overdose or suicide completion. Think of how much less homelessness there would be, less incarceration. The list goes on and on. And that is one of the reasons why we're pushing so hard to try to add, for the legislature, to add $500 million to the budget this year. And I'll hand it over to Bill, because Bill has been our real leader around these issues.
Thank you, Glenn. Let me give a little context to this, and we can go back and forth. So there's a couple of things in our field, as you well know, that are constant. One is change is constant, whether it's state policy that changes from bricks and mortar and institutional settings to the expansion of the community-based settings. It's always a world of change. The other thing that's constant is prices and costs go up, right? We're all living through the gas crisis right now. But over the last 10 or 11 years, our field, which is made up of caring individuals and committed individuals, have not been given the salary increases or the support for their agencies. So this year, Governor Hochul, after a substantial lobbying and advocacy campaign by all the associations, included 5.4% COLA for the human services sector. That 5.4 is not just for employment, but it's also to cover other costs, benefit increases, cost of fuel, cost of insurance increases. But it's a recognition that while not enough, as Glenn pointed out, it's been denied in many years. It's a first step toward keeping the whole mental health, substance abuse, and human service system viable. So the budget proposed 5.4% and about $500 million. However, in legislative speak, the governor proposes and the legislature disposes of the budget actions. So what we're asking for this year is to, one, pass the 5.4%, and we say that thankfully, but secondly, make it an annual commitment to every year to provide a COLA based upon the Consumer Price Index, the CPI, just like state workers get a COLA, just like Social Security recipients just get a COLA, just like defense contractors get COLAs in their contracts. We want an annual increase based on the cost of living across our state. So that's the second ask. And again, that's something we're pushing with our legislative members. And then the third part of the COLA is, when the COLA law was passed under Governor Spitzer back then, for you historians, it included programs that, one, no longer exist, and also didn't include programs that now exist, like health homes for children and adults. So we're asking that the legislation, when they make it permanent, be updated to include the current programs, including housing programs, including children's health homes and adult health homes. So that's the combination of the ask, but that's a great foundation, and we thank the governor first, but we want to go a little bit further, add permanent COLAs, and add an updated list of programs so that the money can go out quickly, because it would be effective April 1, which is a really good thing for our sector right now. So those are the three asks related to COLA. Did I miss anything, Glenn?
No, that was great, Bill. And I just wanted to, again, just to sort of, again, give context because of the fact that, and I saw that John Torriello from our board came on, and John did the math. John was working with Harvey Rosenthal, and they did the math on this, and it came to well over $500 million that's been lost to us. So when we're asking for $500 million, it's not like we're picking a number out of thin air and saying, boy, it'd be great to have $500 million. There's math behind our numbers here. There really is, driven by the logic of the fact that we have not had this funding. And again, I think, having done this for many years, as you have, Bill, and now others have as well, thinking, boy, how different our system would look right now. How much different our world around, behavioral health would be, and human services would be, if we had this funding. So again, we can't look at the past. The past is the past, but going forward in the future, we are working with the legislature to try to add, this year of all budget years, taking $500 million, adding that to the base of our funding. Do the calculation, much like the calculation is going on for the COLA of the 5.4%. Do that same addition and add that $500 million to contracts. That's the simplest, easiest way to do this, the most equitable way to do this. So that's what we're advocating for. And we're not alone. As Bill said, we're not alone in this. This has been a statewide call from advocates, human service advocates from across the state, behavioral health advocates. We meet on a weekly basis. All the statewide behavioral health advocates meet together and we have these conversations. So you're not just hearing it from MHANYS, you're going to hear it from every other, statewide organization as well. So please continue from your end. We need you. We need you as the grassroots to fight for this additional money. You see it. You do it every day. You do the great work every day, and you know the need is there. So please support us in that end.
Let me add one more point, Glenn. So if you're talking to your legislator or staff, they might ask, okay, that's complicated. It's government speak, COLA and CPI. What's going to change if we make this investment? And as Glenn pointed out, lives are going to be saved. Our communities are going to be safer. People will get access for treatment because we have a workforce crisis, right? We don't have enough people out there doing the great work that you're all doing. Life will be better and we'll come out of COVID a little bit stronger so we can rebuild and lead toward recovery, as Glenn says. That's the human face to this calculation of what a COLA is. And it makes New York a better place and a safer place, and it's good for kids and families. So put a face on that number too.
Yep. And again, it's on your list that John talked about in the beginning. So when you're meeting with legislators, show them that list. It's the #1 priority of the agency, the organization. Please, use that in your advocacy. And I'm sure we'll have call-in days, and you've always been so outspoken in those call-in days as well, and we will certainly be doing that as well. So now we're going to shift a little bit to our another issue, and that is around our school-based program. We call it SMART, our school-based mental health training program that MHANYS has been engaged with for many years. As we've talked about in the past, MHANYS, we were very proud that we were among the leaders in the fight for the mandate around mental health instruction in school. New York is the first state in the country that got that. And we were very pleased that we were part of that advocacy. We were also pleased that we were able to get funding for our school resource center as well. The first year we were able to get $1 million from the legislature. For the last 3 years, we've been able to get $500,000 from the executive. And again, it's in this year's budget. So we were pleased to see that. But as we know, where we were 6 years ago to where we are now in terms of the discussion about the importance about school-based mental health and about climate and environment around schools has dramatically changed to a really strong, positive notion about mental health and mental wellness. So we're advocating for additional funding in this year's budget, and we're going to hand it off to our director of our school resource center, Brandon Beecham. So take over, Brandon.
Thank you, Glenn. Thank you. And thank you for highlighting the background of that. It saves me a little bit of time in my first opportunity in my first 7 months here at MHANYS. So it's great to be here. It's great to be here for this, our first of our legislative days. One of the things that I have, when I started in June, at the end of June, my assumption was going to be that there was going to be a lot of requests and calls for us to provide trainings, obviously to school staff and teachers around student mental health. And while we certainly got that and get that, one of the things that I was not prepared for, and one of the things that I wasn't expecting, was the overwhelming number of calls from administrators and superintendents asking for trainings, conversations, presentations, and support for their staff. Not that they didn't worry about their students, but realizing, as we just heard, there is a workforce crisis. And I think today, what we're seeing in this actual school year is we're seeing teachers, school employees, anybody in those educational spaces really being drawn in many directions that they never have been before. Coming out of a pandemic sort of experience, working remotely, trying to keep together their educational continuity for their students, managing what that was like for them. And then coming into this school year, which may feel a little bit more normal, but still anything far from what is ideal. And so one of the things that I have heard from, like I said, superintendents, administrators, is about burnout, fatigue, uncertainty. Speaking really honestly, that a lot of people in our schools are wondering, how much longer can I do this? How do I keep doing the work that I want to do? And it's interesting to point out that teachers, school staff throughout all levels of the school in any role occupy a unique position in our society, right? It's not just a business that in the business of education and learning, but they also are the sort of custodians of our children for that period of time during their day, right? They are taking care of our students. They're taking care of our children in those moments throughout a very large portion of the day. So when we look at the staff shortages that happens, we look at staff being called to support family needs in a way that they may not be equipped to do. They were never trained to sort of address some of the needs that are coming from families and caregivers. And so one of the things that we are advocating for is, as Glenn mentioned, additional funding, but really asking for additional funding to help us bridge the gap between student mental health education and staff training and education. When we train students, when we train teachers to teach kids around mental health, we've always known that there's some sort of residual learning that happens, that they're going to learn things about themselves. They're going to learn things about what it means to be a healthier adult, whether it's around mental health, around mental illness, around the continuum of mental health that we talk about. But one of the things that we recognize as the need is specific and explicit instruction and training for school staff members around how they can learn more around mental health, mental illness, signs and symptoms, wellness, the continuation. We've heard yesterday talking around 8 dimensions, social emotional learning, and one of the challenges is that we want to make sure that this is not something that we are relegating to the health teachers, to the social workers, to the school psychologists, that, as Glenn mentioned, and in our policy brief says, we are talking about climate and culture. And if we are really wanting to impact and positively influence this generation of students and our society, we have to realize, and we are beginning to realize, that mental health instruction, mental health awareness, and mental health care and knowledge is a baseline knowledge that everybody in our schools need to have. And so in that community approach, right, so that we all are understanding that we all have a stake in helping support that climate in our schools. And so, we are seeking that additional $500,000, but we want to sort of expand that beyond just being able to teach school staff for student mental health, but allowing us to expand our reach to really provide some much needed training and support to educators, teachers, administrators. We also are, in our brief, talk about the passage of the A2136, the Fernandez bill, which would require all certified teachers, certified teaching assistants, and certified educational leaders to receive 3 hours of mental health training annually. We know that many teachers across the state are reaching out to us wanting to know more. And this would be another step in making sure that we are sort of moving towards ensuring a climate and culture of mental health education, mental wellness, and also understanding the impacts of mental illness. And so I encourage you, as John shared and as Glenn highlighted, to really review these, share them with your legislators, and be part of that advocacy that we can really make a difference, not only in our schools, but in our communities. So I want to thank you for the time around this issue. Glenn, back to you.
In the 7 months you've been with us, you've just, done a wonderful job. So thank you again for your leadership in this area.
Thank you.
Our next speakers are also internal to MHANYS as well. We're very excited that we have discussed some new legislation this year around the workplace mental health, which is a huge issue. I think we're all very aware of the needs in our community around educating the workforce about mental health. We've certainly, during the pandemic, we know how this issue has just been amplified tenfold. So we're very pleased to have with us today two of our in-house experts around the workforce. We're going to talk about specifically around this legislation. Joelle Monaco is with us and Matt Delaney. So I'll hand it over to Joelle or Matt, whichever one of you.
That would be me. Thank you, Glenn. Thank you so much. So within the last 2 years, we have seen a real paradigm shift in how mental health is perceived and supported in our everyday lives, in schools, in the media. But what about the workplace? No matter where you work, you probably have seen some sort of posting in your lunchroom, front office, in a hallway talking about workplace safety and your rights as an employee. And those are there for a very good reason. We spend half our time, half our lives at work. At least both employees and employers want their employees to be safe and enjoy their work to the best of their ability, and protect them. So within the last 2 years, we've definitely learned that mental health is just as important and paramount as any other occupational safety issue in which we may come across, not only in terms of safety, but for the awareness and parity and importance of our own mental health and wellness as well. So this stemmed in MHANYS and amongst our colleagues such as Joelle, this idea, and it may seem simple, but it would have real consequences in terms of employee mental health and wellness as well as awareness in the workplace. So this is where our workplace mental health awareness and safety bill, now introduced in the legislature, you can find your legislative briefing book as S7577, Senator Brouk, and Assembly Bill 8675, Assemblywoman Gunther. This is really where it came to fruition. So we want to take the approach in this legislation of one, increasing the visibility and awareness of mental health disorders, employees' rights under the Americans with Disabilities Act, and resources available to them. And our second prong of the approach is providing assistance to small and medium-sized businesses across New York State by requiring the Office of Mental Health and the New York State Department of Labor to create a regulatory framework and provide a toolkit to employers surrounding the creation or maintenance of a workplace culture and of acceptance of mental health. Standardized best practices across departments and different roles is essential to ensure that employees have the support they need to be successful and mentally well. So this is vital to New York State's workforce because it would require the Office of Mental Health and Department of Labor to work with one another and push the importance of mental health in the workplace and the support for employees. While Department of Labor and the Office of Mental Health do great work separately, this change would be monumental as these two organizations can share and work together on an issue so important such as mental health support and safety. States such as California and comparable nations even such as Canada already have these voluntary guidelines and resources for employers. So while we know that larger companies in New York State may have very robust human resource departments and resources that they provide to employees, particularly with the negative mental health impacts of the COVID-19 pandemic, small and medium-sized businesses found themselves with nowhere to turn to when employees were showing signs of stress, anxiety, depression, or other mental health signs and symptoms that we may come across. So through these mandated postings of what employees' rights are, their rights under the ADA and various resources such as 988 coming out hopefully in the summer, as well as other resources that New York State has, as well as the creation of this voluntary toolkit for employers through the Department of Labor and Office of Mental Health, we can really see tremendous impacts in the workplaces that we spend at least half of our times in each and every day. And for some more of these impacts, I'm going to turn it over to my colleague, Joelle Monaco.
Thank you, Matt. And I mean, today's conversation, we've already heard several different examples other than what Matt and I are bringing to the conversation about, workforce employees experience from Brandon, from Bill. So, in this half, I really want to talk a little bit more about what would this bill actually mean for businesses and individuals. And given that two-pronged approach that Matt pointed out, it's really our goal that this two-pronged approach assists and supports both the workplace and being the employer and the teams, the employees. First, the mandatory postings would reinforce the idea that mental health is just as important as any other workplace safety issue that we typically see and hear trainings about. It would also support the idea of parity between physical and mental health in our everyday lives. For employers, we really want to develop and provide those toolkits and resources that Matt referenced that are easily accessible, along with providing strategies that have been proven to increase the mental health and wellness of individuals within the workplace. These postings, toolkits, and resources would include employee rights, resources that are available to individuals, not to mention creating a more understanding and inclusive and accepting workplace for individuals. We understand, to Matt's point, that small and medium businesses are really the backbone of our New York State economy. So we want to be sure that we're providing the type of support to really affect change in our society and in our workforce, but also to prepare the workforce for the future and bring them to the next iteration of what workplace is and what the workplace needs of the individuals they're employing truly are, including that of mental health and well-being. This legislation is innovative and really begins and brings New York State workforce into the 21st century. So aside from how this bill would be implemented, it's also important to highlight how this would impact and influence the workplace and our community. As you'll hear several times today, and you're all on here, we understand mental health is part of everyone's health and well-being, and that includes when individuals are at the workplace. If we consider in the workplace, it's estimated that more than 2 in 5 employees state that they've ever been diagnosed with a mental health disorder. This is very much a workplace topic, and time for a bill such as this to really elevate the conversation through the development and distribution of this material, the materials provided in this bill. We would again be able to increase the awareness and knowledge around mental health in the workplace and across New York State. We'd be able to reduce the stigma that's too often, I should say, associated with mental health in the workplace. Additionally, this bill would increase the conversation and aid to New Yorkers in supporting themselves, their colleagues, those they care about, along with understanding what is accessible in the workplace. As for workplaces, this bill would really enable employers to educate their teams, have conversations, not to mention make resources and services accessible that they might not otherwise know were even available within their community or within their workplace. In many cases, again, leadership would have an increased access to those tools that they might not, especially if they're a small to medium business, as Matt pointed out, and we've heard time and time again. But they would also be able to create community connections with resources in their own backyard to really create a collaborative and supportive community. All in all, this would make a more inclusive workspace where individuals feel supported and are able to reach out and connect with care. And businesses employ community members. And to Matt's point, adults spend the majority of their time in the workplace. So if we're having conversations and we know where and how to access resources in the workplace and they're readily available, it's thus impacting our overall communities, mental health, and well-being. So in saying that, I'm going to pass it back to Glenn.
Great. Thank you. Thank you both so much. And you can see this is how knowledgeable and passionate our folks are about this issue. And to their credit, we met and presented to Senator Brouk's staff, and they were just very impressed, and they actually introduced legislation, as Matt had mentioned, and Assembly Member Gunther also introduced similar legislation, and I know it's in your briefing books, and hopefully you feel as strongly as we do about the importance of this and that you will support it. And again, this is not budget-specific issues, so the budget will be closed hopefully by April 1, but this will go on for the rest of legislative session, which would be early June. Now, obviously, the sooner the better it's passed from our perspective, but we certainly hope that let folks know that we're going to be continuing this advocacy post budget, in terms of fighting for this important legislation. So I just, as we're moving on, this is, at MHANYS, we try to really, it's really about the lifespan. We work, you heard from Brandon about, issues around school and youth, and you just heard from Joelle and Matt about workplace issues. Well, another issue that we decided and the board decided, we decided was of great importance to us was around college mental health. This has often been an unseen issue, and obviously with COVID and the impact of COVID, it's becoming more and more spotlighted. And so we thought it was important for us to do a deep dive in that area. And so I'm going to hand it over to John, again, to hear from John, who did, a tremendous white paper on this, and it's already garnered a lot of interest and publicity in the community. So, John's going to talk a little bit about the white paper and two of the seminal issues that have come out because of this. So, John.
Thanks, Glenn. And you're right, Glenn. There's a natural and logical progression that we moved from the work that we did in K through 12. And that we move toward now expanding our policy footprint, if you will, into colleges. For several years now, in fact, we've been tracking and watching closely and studying what's been happening in colleges with regard to student mental health. And I think we have enough evidence now to be able to say that truly there is a mental health crisis in higher education in this country and in this state more specifically. So that work that we did in tracking what's happening in colleges and studying it kind of culminated in a release of our white paper, which came out a couple of weeks ago. And the white paper really kind of makes the case. It presents the evidence. The evidence, I won't share the specifics with you. I went into a lot of that yesterday. I hope you had a chance to hear that. But basically the evidence of that focuses on about a 10-year period prior to the pandemic really shows a significant uptick, not only in the prevalence of mental health conditions among college students, but also in the degree to which they were accessing services. And on one hand, that's a good thing that more people are accessing services, but it also strains colleges and their capacity to be able to help their students. So the white paper, again, it kind of kick-started our public policy campaign, if you will, into this area. And it also looks at what the public response has been to this crisis. How has the media handled it? What's been happening with advocacy efforts to help college students? What's been going on in the courts? And of particular concern to us is what's been going on in the legislatures from a public policy standpoint. And we think that more can be done to address this issue in public policy. And we've kind of laid out our in broad strokes, our policy framework, if you will. We've made two broad recommendations. Now, the first one has to do with mental health literacy. And you see this across a number of policy initiatives that MHANYS is involved in. Mental health literacy, we believe, is a really important change agent. Brandon talked about this, how mental health literacy in K through 12 shifts the culture, and we're borrowing from that same idea. We can shift the culture on college campuses by elevating mental health literacy among not only the students, but also the staff. And interestingly, there is a continuity to what we've been doing in K through 12 and now in colleges insofar as, mental health literacy is concerned. The students that we're seeing now that are in crisis in colleges, one would hope that the students of the future who have had an opportunity to receive mental health instruction in K through 12, they'll one day be our future college students. And hopefully they'll be better prepared and more knowledgeable when they get to college. And that will actually be bending that curve on the incidence of college mental health conditions because of the work that we're doing in K through 12. Nonetheless, we still feel it's important that college students and college staff receive training about mental health. And in another policy area of focus in our framework has to do with what we call whole health parity. And we really want to not only encourage, but resource colleges in a way that they're able to take another look and evaluate their policies around things like leaves of absence and the way that colleges respond to crises on campuses, the way that colleges interact with students around what students are experiencing, on any given day, and that colleges are able to evaluate these policies and update them and bring them to a level where the college is regarding mental health with the same amount of respect and the same amount of dignity that they treat students who have physical health issues. So mental health literacy and whole health policy, that's sort of the two-legged framework for what we're proposing. Our policies in higher education are evolving. We have a lot of work to do in bringing together the mental health community and the higher education community to sort of flesh out just a more nuanced and a more specific public policy ask, and that will come. But in the meantime, we do have for today a specific policy ask in this area. And it is a bill that's been introduced by Senator Kaplan. It's Senate 7659. This is all included in the issue brief, by the way. And this bill does a number of things that align with those two policy principles that I just talked: mental health literacy and whole health parity. And this bill contains elements of both of those. Now it applies to only to SUNY and CUNY schools. I say only, but that's a lot of schools. That's 89 colleges in the state. And what it does is it does a number of things. It has a number of provisions, including that the schools would have to survey their students at least once a year with regard to where students are at in terms of their own mental health. So it kind of takes a pulse of the students, if you will, on a regular basis and where their students are at from them. And that's really important for tracking purposes to see how we're doing and how students are doing. It would require schools to form a committee that would make recommendations to the university and to disseminate resources to students. And it would require training for faculty and for staff. It would require student orientation in mental health. It would require schools to review regularly their enrollment and their re-enrollment policies, to create opportunities for telehealth, and also to look at their policies around mental health absence days. So there you have those policies around whole health parity, but you also have elements of mental health literacy. So it's a really good bill from that standpoint. It has a lot of provisions that we think are really important. But again, it does only apply to SUNY and CUNY schools, and there are 143 other colleges out there that are private. And we believe, we would like to make a difference in those schools as well. That represents almost 500,000 students who are not in the SUNY or CUNY system. And so we'll be working to see if we can't find a way to either encourage the sponsor of this bill to make either some changes or maybe a companion bill, or another bill would be introduced to also cover private colleges. So again, if you want a deeper dive on all of this stuff, go look at our white paper. You can find that on our legislative action community. But if you want to get up to speed real quick and just do a quick review, we have an issue brief on this as we do the other issues. I'm going to leave it right there, Glenn. Turn it back to you. I know we're getting close to 11 o'clock. We still have 2 issues left to talk about. You're on mute.
It's really groundbreaking, and thank you for your work on that. And we're pleased that in a few minutes we're going to hear from Senator Kaplan, who's going to talk a little bit more about the bill and the framework for the legislation as well. It's about time that this is a bill. This work is front and center. So that's great. Thank you for your leadership on that. And speaking of leadership, I'm going to go next to an issue that has been so significant to us around veterans' mental health and the Dwyer Project. And there's Jeff. And I've got to say, about going back now, probably about, I don't even know anymore, 5, 6, 7 years ago, we had Jeff come in and speak to us about veterans' mental health. And it really was integral to the whole discussion around Dwyer and the whole changes around veterans' mental health issue. And we're really pleased that the governor took funding from, it had been a legislative ad all these years, and the governor actually added funding in the budget this year for Dwyer. And now we're hoping that the legislature will, as they've done in the past, continue to do that. But I think Jeff's leadership had a lot to do with that. And he's just such a strong advocate, both as the director of our Nassau MHAs and board member of ours, board member of NIAPRS, and just a really strong leader in this area. And we're really pleased to have him with us today. So Jeff, the floor is yours. Thank you.
Thank you very much, Glenn. And I'm trying not to hold y'all hostage. I think what's important, it's nice to know that that more money has been put in the budget for this year, and that the work that we've been doing, Suffolk and Nassau County and the other supporting counties will continue to exist. But we can't ignore the fact that the concerns for our veterans' mental health are still there. We know that there are already a consistent basis of underlying issues with our veterans that are returning home, on top of the fact that we have a continued concern in our community with the syndemic that we're dealing with right now, right? We have COVID going on. There's a lot of social unrest. There are a lot of concerns abroad, concerning conflict and what's going on in Afghanistan and what just recently transpired in Afghanistan and now in the Ukraine. And so, even with COVID, and my numbers may be incorrect, but I believe that the number was approximately 55 senior veterans passed away from COVID in our veterans home in Suffolk County, right? And so I just want you to understand the impact that this must have on the other veterans who have been living with these veterans for years, right? And that these were their friends, and this is family. These are the people that we talk to consistently every day, day in and day out, only to wake up the next day and to see that another 4 have passed, and then the next day another 7 have passed, and then the next, right? So this is just one concern. Our numbers for veterans ending their lives by way of suicide still exists. The numbers are still very high. We still have a lot of work to do, and I say this all the time. The military made no mistakes or errors about teaching me how to be a soldier. They did that very well, right? Very well. What they didn't teach me how to do was be a civilian. They did not teach me how to return back to this life, and how to deal with the day-to-day concerns and issues that I would be up against, and so we have a lot of work to do within our community. I see Marcel Lease is there, is on with us, and she does tremendous work. That's my counterpart out in Suffolk. And, just in Long Island alone, we are working, continuously and around the clock to support what is my numbers, I believe, to be like 173,000 veterans, right? And so statewide, we have our hands full. There is a lot of work to do. And so we need to make sure that our government is aware of this work. We need to make sure that our government continues to fund it so that we can continue to bring veterans home and provide them with the support and the care that they need in their civilian life, right? Because this thing goes without saying. Veterans come home jobless, homeless, clothesless. Like, this happens every day in our society, right? And so we want to be able to continue to provide them not just the physical and the residential needs, but they also need support with the wound that is unseen, and that's what we're talking about. We're talking about being able to make sure that we provide the whole person with wellness, and a wellness that definitely addresses, their mental health, right? And so I thank y'all for taking out the time to listen to me, and I hope that you'll continue to keep this at the forefront of the work that we do. Thank you.
So Jeff, inspirational, so well said. And it's just, you know, you're so right. We are so, you know, as you said, you know, you learned everything about being in the military, and yet civilian life completely different. And this dichotomy, I think, is a sad fact in our nation. And I think that we are hoping with people like you continuing to raise the visibility of this issue. And I know the Dwyer Project is something that we have long supported. I know you were one of the leaders in the creation of this peer-to-peer model for veterans, because, you know, better than anyone, veterans are, you know, not necessarily comfortable talking to, you know, other folks about their mental health related issues. It's a veteran to veteran connection. And I think it's a very powerful connection. I think that's why the Dwyer Project has been so successful. And that's why we're really pleased that the governor has taken it in her budget and putting it there. And again, the legislature has been really very supportive in the past, and we hope that they will continue their support. And that is one of our top priorities this year as well, to make sure that that funding continues. So thank you very much for your leadership, Jeff, and thank you for your service to the country. Thank you.
Thank you, Glenn.
Yep. And so we are about to go into our next phase of the group, but we still have a few more minutes to talk about one other issue. And I just want to let folks know that, you know, hopefully next year we'll be seeing you all in person. 2 years ago when COVID first struck, you know, John and I often talk about this, that 2 years ago when COVID first struck, we were days away from deciding if we were going to shut it down or not. And we had over 800 people coming to our event in person. And we were so excited about it. And then COVID hit and we ended up having to cancel. But we hope to garner that kind of level of enthusiasm, momentum again in person, moving forward to hopefully next year at this time, when we will have that kind of amount of enthusiasm and positive. Because we have been everybody has been raising the visibility of mental health. We have seen it since COVID, even more so, that everybody is so much more open about talking about mental health issues. We've seen it from everybody on down, from celebrities, from athletes, from everybody. People are more willing to talk about it, and it's significant. And hopefully next year we'll be able to coalesce together and have, you know, several thousand people in attendance next year for our event. Let's hope for that. So the final issue I'm just going to talk about, and I know that Dr. Cunningham, the OASIS commissioner, should be joining us shortly, but another issue, and I'll get back to it if she comes on, is the crisis services for behavioral health in New York. 988 is coming on in July. 988 will be the new suicide prevention lifeline, but it's more than that. It's all about behavioral health as well. So if you're in an addictions crisis, if you're in a mental health crisis, you can call 988, much like you call 911 for a crisis. Now it's going to be shifting to 988. And that takes an incredible amount of resources, training, infrastructure to make those changes. And I think that it's tremendous that the governor has consistently been supportive of this. She added funding in this year's budget to that end, which I talked about earlier, and she's adding $60 million to next year's budget for that. So it goes from $35 million to $60 million in next year's budget. So it's well funded, and that's terrific. And there's also sort of like this three-tiered piece around crisis stabilization centers, which are also being funded. And there is also going to be more work around mobile crisis teams as well. So there is going to be this model of integration that we're very excited about. I'm sure that Commissioner Sullivan will probably talk a little bit about it, but we're very excited about that. But one thing that we want to see happen, and it's not going to happen this year, we know it's not going to happen this year because the governor has funded this for 2 years. We're looking for permanent funding for this program. We're looking to add a tax to mobile phones, to all phones rather, an excise tax, much like we've seen with the funding for 911. And in other states, like when we heard this yesterday in our presentation, other states like Washington and Virginia are already doing this. In Washington, they're estimating that it's a cost of about 40 cents a month to add 988 to all phone service in the state. 40 cents a month. I don't think there's anybody who wouldn't agree that 40 cents a month is worth our time and effort to fund a full 988 complementary services around 988, around other programs as around stabilization, mobile crisis. So that is a big issue for us, and that will continue to be a big issue for us. But again, we will be talking a lot about 988, especially in July when it comes out. So we look forward to having those conversations. But I see that we're very pleased that Commissioner Cunningham has joined us. Commissioner Cunningham, welcome.
Thank you.
Yep, I just would like to introduce you. I don't see you.
Can you?
There you are. Good
Okay.
morning. Good morning. So I'd like to introduce Dr. Chinazo Cunningham. Dr. Cunningham is the new commissioner of OASS. She is a physician, researcher, and public health professional who brings over 20 years of expertise in substance use treatment to OASS. Prior to joining OASS, she served as the executive deputy commissioner of mental hygiene at the New York City Department of Health and Mental Hygiene, was a practicing physician in Montefiore Health Systems, and a professor of medicine, family and social medicine, and psychiatry and behavioral health sciences at the Albert Einstein School of Medicine. But more than that, I can just say in the brief time I've known her, as being a member of the Behavioral Health Advisory Council, we've had her speak several times to us, and she really gets it. She gets that connection between mental health and substance use, and she can talk about it and is very passionate about it and clearly understands the different systems, but in a way that, as an advocate, hearing it from an advocate's voice, I think you really explain it well, and you recognize how those connections have to continue to be made. And I'm so glad that you already have a great relationship with Commissioner Sullivan and, the entire, leadership of the state. So Commissioner Cunningham, welcome. Congratulations on your appointment. I know it's been several months now, and we look forward to hearing from you. Thank you.
Great. Thank you so much. And thank you for inviting me to be part of this day. So, as you said, I'm commissioner at OASS for all of 3 months. But prior to coming here, I was the executive deputy commissioner of mental hygiene at the New York City Health Department, where I oversaw mental health, substance use, and work with people with developmental disabilities. And then prior to that, for over 20 years, I was a practicing primary care provider in the Bronx, working out of a federally qualified health center, seeing people who use drugs, developing programs to improve access to care and health outcomes, and conducting research really to think about how can we deliver care better for this population. So given my experience as a primary care provider and providing care for people who use drugs, I'm very familiar with the overlapping issues of substance use and mental health conditions. And, as a provider, for me, dealing with the substance use was actually easier than dealing with the mental health issues. And so I recognize I have lived through, the challenges and really trying to get the care for my patients who needed it, and navigating systems that were not so easy, especially, for people who were Spanish speaking or, other conditions. So having been on the ground for so many years, I really, understand the issues really at that level. And then also, having worked at the New York City Health Department, also understand from a systems level and a public health level, what some of the challenges are. And, right now with COVID, clearly, again, having been a provider in the hospitals during the first and second waves of COVID, really the trauma that individuals, communities, providers have gone through. And for me, really the worst days of my entire career were while providing care on the COVID wards, and just, the fear and the trauma, the destruction, the death that it's had on us. And I don't think we even really know the long-term toll of that in terms of our mental health. So that's to say that I certainly get it in many ways. So in my role as Commissioner OSS, I look forward to continuing the work with the Office of Mental Health and Commissioner Sullivan. And, we've met many times before I even got here. And so I feel like we've had a jump start to working together. And, again, recognize the overlap with substance use and mental health co-occurring disorders. And so, we've had many discussions about how to address this. And I know there's been a lot of cross-training between, providers and agencies and, thinking about innovative ways in which we can work together to address co-occurring disorders. And so some of the things that I'm really excited about include, the crisis stabilization centers, right? So that's supported both by OASS and OMH. That's really addressing people who have substance use and or mental health, emergencies or urgencies, crises, and really sort of coming together to think about how to address both of these issues, making sure that the funding is there, the staffing is there, the resources are there for people, and that there's one door that people can go into. And I think those are the kinds of initiatives that I think are really important going forward. And certainly, I'm committed to, and I know Commissioner Sullivan is committed to, and really working together. Other ways in which we're working together include, the subway systems, street, outreach with homelessness. I mean, we can't not work together, right? I mean, the issues are complex. And so we really need everybody, working together for, challenging solutions and innovative solutions, because frankly, I think we're seeing how COVID has made so many things worse, and this is certainly one area. And the intersection between social issues, substance use issues, mental health issues is really challenging. And so we need all of us to come together to think about creative solutions. So, and then last, I just want to talk about workforce. The workforce issues are very challenging in behavioral health, really across, healthcare in general. And so, supporting our workforce, thinking about, again, innovative ways to do that is really critical for, our behavioral health field, how to bring people, thinking about how to bring people into this field and then how to keep people in the field is really important. And working together to think about innovative ways to do that is certainly a priority as well. So, I look forward to this, our continued partnership, recognize really the importance for systems and for people and communities, and just working together to address some of the really most complex, challenging issues for some of the most vulnerable populations in New York.
Great. Thank you. Thank you so much, Commissioner. I think that we appreciate your openness and we appreciate your interest in finding out more about our sector as well, which obviously you do have a great expertise in. So we look forward to that integration discussion. So thank you very much for your time. Really appreciate it. I know how busy you are.
Glenn, is that snow behind the commissioner?
Yes, yes, it is.
That's trauma.
You scared me. You scared me. I saw that. I was like, so thank you very much, Commissioner. I really appreciate it. And you have a great team with you too. That's a great group of folks. So anyway, our next speaker, we're very pleased to have with us our mental hygiene chair, Senator Brouk. Senator, I know she's coming on. There she is. Hey, Senator, how are you? So it's very interesting. And I'm not going to read her list of impressive credentials, but I just will say personally, so, having done this a while and you don't know, we knew we were going to have a new chair last year in the mental hygiene committee, but, and Senator Brouk became the chair, and we didn't know her. We didn't know a lot about it. Obviously, we were skirting around trying to find information. And what we found and what we've seen is somebody who is tremendous, just a great advocate, not only incredibly smart and passionate, but really is such a tremendous advocate and so passionate about our issues. And when we talked about last year, when we talked about a COLA, which was 1%, we hadn't had a COLA prior to that for many years. Senator Brouk was the leader in that fight. when we talk about 988, when we talk about crisis services, when we're talking about the workforce legislation, you name it, she has been a leader for us. And we are so glad that she is our chair. We're so glad that she has been such a strong, innovative leader in our field. And we're just honored to have you with us today, Senator, and we look forward to hearing from you. So thank you. Thank you for being our champion. Thank you so much.
Well, absolutely. It's such an honor, and it's always so wonderful to be here with all of you. The beauty is now I recognize the faces on all of these Zooms with us, because we've got just about a year under our belts. If you can believe, we've truly only been doing this together for about 12 months, 13 months, which is wild. And, you know, I'll tell you a funny little story, because it reminds me of what you're talking about, Glenn. You didn't really know what you were getting. It was this new, fresh, you know, first-year senator from Rochester. You know, she's on this new committee because it's now mental health alone, right? We've separated out of developmental disabilities, which gives, I think, more power to this specific standalone committee. And, you know, we're not the biggest committee, right? I mean, it's not the health committee and the education. We know what a big part of the budget that is. But I was doing an interview recently, and someone was asking me about doing theater. I promise there's a point here, doing theater as a young person. And they said, you know, well, what did you do when you were just in the chorus? Or what did you do if you didn't have the big lead? And I said, there's no small parts. You give it your all, and you do everything, and you leave it all on the stage. And so if there's anybody who did theater when they were little, understands that, you know, mental health, as you all know, is not something that was on everyone's minds a few years ago. Case in point, you couldn't convince an administration that a measly 1% increase in cost of living was worth doing for over a decade, right? And then all of a sudden, you know, we started working together, and you know, a few folks have told me, you know, wow, you're really pushing it now, you know, like you all won't relent, and we won't. I don't know how to relent, because there's lives on the line, frankly. And we've seen what happens when we don't give the attention and the resources. And one of the things that was mind-boggling to me to step into this position last year was to realize that my job as chair in the Senate was mostly to claw back as many resources and as many dollars as possible. And with many of you as advocates doing that work, you know, you come in thinking it is your job to innovate and find new solutions. But for a lot of the past few years, it has been simply just trying to stay afloat and simply just trying to keep the status quo. And so I want to commend all of you, because you have been doing this work in the trenches. Many personally, or people you care about touched by mental illness, by a lack of resources, or you yourselves are the providers who have not gotten the wages you deserve and the credit and acknowledgement that you deserve for doing this work. And so that's how we continue to move forward. And I have to say, it is just such an honor to be able to work with you all on some very, very important things that we are now able to advance. You know, 1%, 1%, that was, you know, our foot in the door last year. And now we're sitting here talking about having already achieved our 5.4%, which allows us to fight for even more, because we know that there's so much more to do to get us where we need to go. I also want to thank you for your leadership in the mental health workforce bill, because that's, you know, when we think about creating parity between mental health and physical health, listen, we all know the signs at work that tell you, here's what happens if you get hurt. Here's what your minimum wage you're entitled to. Well, what about mental health? Who's letting people know where their mental health resources are? Who's letting people know that there is help out there if they need it? And I'll tell you, when I talk to a lot of small businesses and employers right now, one of the top things that they're talking about is the mental health of their employees. There's two things keeping a lot of people out of the workforce: childcare and mental health after the last 2 years. We have to change the way we're doing things. So this is a step, and I appreciate your leadership, and we'll continue to work to get that through the Senate and the Assembly, but even being able to share information with people so that they know what is available to them. Of course, when we're talking about workforce, we know that we also have to be able to move forward. My legislation around allowing more of our mental health providers to diagnose, to treat people. We know that if we don't do this work, we will find ourselves in a greater crisis. We're already in a crisis. I've got teenagers who aren't my constituents, frankly. They live elsewhere in New York, writing me to say their friends started drinking over the pandemic. They can't get through the day and they have no idea what to do. Put yourself in a 16-year-old's position. Did you know who your state senator was? Did you know who the chair of your Senate Mental Health Committee was? Think about the desperation that means these kids are facing, that they are digging so deep into the internet, looking for someone who will offer them some help. And when I'm getting letters like that, it tells me we're doing the right things, but we have to keep doing more. That's also why last week I introduced the Student Lifeline Act. So I know if you haven't heard from Commissioner Sullivan, you will hear from her about the work that they are doing to get 988 built and make sure that we have people here locally in New York picking up the phone for people in crisis. Well, we want to make sure that the secondary and post-secondary students who have been hit at higher rates with mental illness right now have those resources as well. So the Student Lifeline Act would put that 988 number on every high school and college student ID card. The work that you all do has shown that there is a greater need for these folks, and we need to do more to get them resources. And the final thing, as we think about our young people, is in this year's budget, we're fighting to get 5 free telemental health appointments for any young person in New York State who needs it. The problem we see with a lot of folks is that they don't have care in their immediate communities. They don't have a provider ready. They're waiting months for care. Well, I'm here to say we can't wait until we build up the psychologists and social workers in our schools to treat young people. They need the help now. So this would be something that would allow, starting in August, that they would have access to at least a few appointments to onboard them to treatment and be able to access folks in a way that is easier many times for young people as well. So I'm going to stop there because there are so many things that I'm proud to be working on with all of you. And I just, again, want to share so much gratitude I have for not only you being willing to jump in with me on new things that I bring to you that I want to run with, but also for always having the open communication and for never relenting with your advocacy, because we've seen what can happen in the past, as we said, 13 months, and we know that there's so much more that we want to do together. So thank you all. I'm with you in the fight and ready to, go to the mat when we need to these next few weeks to make sure that this is a budget that finally reflects the increased need for mental health and our workforce in New York State. Thank you all.
Thank you. Thank you so much, Senator. Inspirational. It really is. And I know, obviously we have our sources and we know how hard you're pushing on the 500 million as well. You're just a strong leader for us. Thank you. And next time you come on, we're going to ask you to sing some Hamilton for us.
We'll see how this budget goes and maybe we'll celebrate.
There we go. We'll have to have you over to sing some Hamilton. I'll sing some West Side Story, but you don't want to hear me sing. All right, great. Thank you so much, Senator. And we have next with us a new friend. John referenced her earlier, Senator Kaplan. Hello, Senator. John referenced her earlier about our leader around college mental health issues, and we're so pleased she's here. And a special introduction from someone she knows well, Matt Delaney. Matt, you're on to introduce the senator. As soon as he gets the green light.
Great, thank you, Glenn. I appreciate it. I couldn't unmute myself for a moment. And thanks to Senator Brouk for always being a great champion for MHANYS. So next, it is our great pleasure to introduce Senator Anna M. Kaplan of Nassau County. who Glenn, along with the rest of us here at MHANYS, are so excited to have here today as an advocate for us and college mental health. And as a former session assistant for the senator in her Albany office in 2019, I am so pleased to introduce her here today. We at MHANYS are so happy to see that the senator's bill, Senate Bill 7659, includes a number of provisions that are consistent with recommendations released in our white paper just over 2 weeks ago to improve the mental health literacy in New York's public colleges and universities and address the needs of students and improve their mental health related policies on our SUNY and CUNY campuses. So Senator, great to see you, and the floor is yours.
We can't hear you. Senator, we can't hear you.
I'm so sorry.
There you
Good
go.
morning,
Thank you.
everybody. Matt,
Good morning.
it's so nice to see you this morning. It's so nice to see you growing as a person, coming into your own and really taking such a leadership position and working so hard and advocating for all good things for our residents in state of New York. And I have to say, it is hard to follow Senator Brouk. You can hear the passion in her. You couldn't have a better champion than her to chair mental health. But I hope you all know this is something that our conference is definitely collectively is very much supportive of and understands how important it is. And we will work very hard and diligently to make sure your voices are being heard, especially in this budget and every budget after this.
Thank you.
With that, I want to thank you for the opportunity to speak here before you all today. This is my first time speaking at MHANYS, and I want to thank Glenn for this opportunity. I'm honored to be part of this wonderful panel. A year ago, I was speaking with a member of my team about mental health needs of college students and what more we could do to support them, particularly in these challenging times. From that conversation, Senate Bill 7659 was born. In researching the need for this legislation, I found that our colleges here in New York State are truly lacking in the amount of and types of resources they make available to college students. Thanks to MHANY's leadership, a few years ago, a new law requiring mental health education in our public schools was passed. That legislation, to me, represents a turning point on how we should be looking at and addressing mental health needs in all our schools, whether elementary, secondary, or college. Through mental health education, we are helping to end the stigma of mental health illness with our students and addressing their needs from an early age. However, as a state, we seem to stop talking about and supporting students suffering from mental health illness when they get to college. I believe this is a significant problem and one I'm hoping my legislation will address. My legislation takes numerous steps to address student mental health needs, including requiring mental health surveys to be provided to all students, creating a committee that will be responsible for engaging with and disseminating mental health resources to faculty, staff, and students. This committee would also make recommendations regarding how often and in what manner faculty of the university shall provide mental health wellness days and excused absence from class for students, as well as considering other programs to address and improve student mental health. S7659 will also require faculty and staff to undergo mental health training on an annual basis with a focus on identifying or recognizing the signs of mental distress among students. The bill also requires a review of enrollment and re-enrollment policies regarding specific provisions for students that may require extended mental health leave, as well as creating opportunities for telehealth and virtual counseling options, and to require a mental health seminar for all newly enrolled students. As a legislator, when you come forward with a proposal on a topic, you hope that organizations will share your goals. As you all well know, about a month ago, MHANYS put forward a white paper entitled Mental Health and Higher Education in New York, a call for public policy response written by John Richer. In reading this report, it is clear that MHANYS' goals and goals of my legislation are the same. I am honored to have the support of such venerable organization, and I look forward to working together to achieve passage of this legislation and to address the mental health needs of our New York college students. Thank you.
Thank you. Thank you so much, Senator. We really appreciate your support and your leadership on this issue. We're so glad you're part of our family now. So thank you so much. And thank you for your leadership.
Thank you
for your leadership. Yep. We look forward to continuing to work with you. Thank you. So our next speaker, unfortunately, we don't know if Assembly Member Gunther was called to a committee meeting, so we don't know if she'll be able to come on. And we know what a passionate voice she has been on these issues. But so we have another passionate voice, someone who's been a great friend to us over the years and a great advocate for us, both internal and external. And I'm going to have Bill introduce her, and that is Commissioner Ann Sullivan.
Thank
So
you,
Bill,
Glenn. It's my honor. I will be brief. Commissioner Sullivan, welcome. One thing you know about Commissioner Sullivan, when you look up her name in the dictionary, which is an old-fashioned document, it's a book. What you hear and read about Commissioner Sullivan is she's a leader. She's a champion for kids, families, adults in our community. She's a provider. She rolls up her sleeve and she does work every day to further the mission of mental health services. She's also a grandparent. So she touches all the important things that makes her just a genuine, wonderful person. And then professionally, she's an innovator, and she has led the Office of Mental Health through tough times and good times. And even in this year's budget, as we talked about, there's so many exciting things out there, from 988 to workforce investments to the crisis response plan and all the many, many new ideas and trainings that are coming. So it's my pleasure to say thank you, Dr. Sullivan. Welcome to the MHANYS Day, and we love your passion, and we hope you're safe and well. So back to you.
Thank you so much, and thank you for those lovely words. Thank you, Bill, and thank you, Glenn. And first of all, thank you all for what you do. You know, we have a really, I think, and I know you do too, a really good budget this year, but it wouldn't have been possible without all of you. You've been there, you've advocated, and so many of the things that have been on your advocacy list for so long are coming true. So I'm going to go through some of that, but the first thing I have to say is thank you. Thank you for what you've done, and also thank you for these last 2 years. You know, I mean, every day when I wake up, I think how remarkable it is that the mental health community has been here for these 2 years, serving our clients, been there every day, gotten through what's probably one of the most tumultuous times that I've ever seen in my lifetime. And thank you for that. So you're all champions out there, and thank you. And I think it's just very exciting today to be able to talk about some of the great things that I think are in the budget that are the beginning of moving forward in a way that I think we've all wanted for a long time. And of course, the first big thing is that I can't thank you, Glenn, you, the team, Bill, everybody, for the 5.4% COLA. I mean, I remember many, many years of you coming forward and saying how important this was, and that it's finally happened. So thank you. And it's also a lesson, I think, for all of us that sometimes persistence and continuing to ring that bell, I was going to say, because it's that mental health association bell, keep saying it, keep ringing it, and you get it. So that's a tremendous help for the workforce. But there's other pieces too that will come together, I think, to even support the workforce more. I think between a combination of what's in the budget, also what's in the FMAP and what's been in the mental health block grant, we're going to be able to increase clinic rates, not by 5.4%, but on top of that, another 4.6. So the clinic rates will go up about 10%, which I think is great. We're going to be increasing the inpatient rates by 20% to give some increased availability of beds. We're increasing rates of ACTs and PROs and lots of other programs, and those will be long-term. They won't be just temporary for some of the FMAP. So I think those are all really important things that will help build the infrastructure. And I think that what's great about this governor and the approach to our problems is it's not just new things. You know, often it's important, budgets have lots of new things, and we're going to talk about those. But this budget also shores up the infrastructure and says that we know that people need money in salaries. We know that we need money in capital for and other things, for example, for housing. And I'm going to go into that. But this shores up the infrastructure. So I think that that's critical. The other thing is, I know that workforce is very complicated and there's many pieces of it. One of them is salaries, other is getting people into the field. So there's going to be nurses across New York. There's going to be physicians across New York. And we're also working with SUNY and CUNY on a pipeline for social workers with some tuition assistance linked to people who will be working in the mental health field. So there are a number of ways that we're also trying to entice people into the field. And I think that they're more important than we sometimes think. They're pipelines, they take a long time, but if you get those pipelines working on a regular basis, they can be very effective. And then the other thing we're looking at is, you know, how can we expand the workforce? And we're going to be talking about that too with all of you, whether or not there's some community workers in the health workforce that could be also helpful. So there's a lot going on with workforce. There are also the bonuses. And I think it's a good time. It needs to be more. I know you guys will continue to advocate for much more, and I know you are, but I think it's a very good beginning. It's a strong beginning, and I think that's really positive. The other thing is the infrastructure of housing. Just very briefly, you know, we've been dealing with this for a long time, but there's 65 million more just for supportive housing to build up that infrastructure of our supported system, and 39 million guaranteed for next year. So that brings us close to 160 million over the past few years that we've invested in housing, in current housing, to get those rates up. Now, we also know that in some places the rents are going sky high, but we're getting closer and closer to being able to deal with some of that. So that's another important infrastructure piece that's been built in. And then on top of that, there's the other big infrastructure piece, which I know some of you on the child side, is the RTFs. And we're going to be increasing significantly the rates for the RTFs and stabilizing that system so that the RTF beds that we currently have, we won't see any more closures, and also stabilizing the CO with an increase in rates that will be ongoing. So those pieces are really very, very important, and the CFTSS for kids. And then there's a whole bunch of new initiatives that I think just going to highlight a couple. And the big one is what's already been mentioned, and I think is very exciting, is 988 in the crisis system. And we do have, at least for this year, we have the 35 million that's in the budget for this year, which will get us definitely through this year, and then up to an increase for next year, which is in the budget and ongoing. So I think that we do have dollars that will be helpful with getting 988 started. And 988 is more than just a call-in line. It has to be a connection to all the services that we've all wanted that connection for so many years. So it'll be a connection to clinic services, it'll be a connection to crisis stabilization services, to mobile crisis. It should be really a significant game changer, I think. People who need services should be able to get, with one number, access. And I think you just heard Senator Brouk say she wants to put it on the cards for students. I think that's terrific, because it's an easy 3 digits. You call and you can get what you need then and there. And it's going to be combined. We're working very closely with OASIS so that it's a kind of one-stop shopping kind of thing. So the 988, I mean, there will also be other lines in OASIS, but this one will serve substance use as well as mental health. So if you call with that kind of problem, we'll get you the services. If you call with substance use issues, or if you call with mental health. So I think it's that kind of connectability which we need to do. So what we're building new, I do want to emphasize, is really a lot is hand in glove with OASIS. And I think that Commissioner Cunningham is terrific in this respect, and we're joining together for the stabilization centers, for the 988 number, et cetera. So I think that there's a real opportunity here, just whatever's new, to build up in that integrated way and then continue the growth of integration in some of our clinics and other things which already exist. So that's a really, going forward, is very, very important. And then I think what's personally very exciting, because when I started working in mental health, I worked on outreach teams for the homeless in New York City, and that was in 1980s, 70s, 80s. So we go back a ways here with this issue of homeless individuals, some of our seriously, individuals with significant mental illness being on the streets and in the subways, and we hadn't solved it. Obviously we haven't. I think it's better. I can tell you honestly, it's better than it was in the 70s and 80s. But it's nowhere near where it needs to be. And I think a major, major effort is being done now with both the city and the state in New York City and the city and the counties upstate to really work on this issue and for the first time take it on head on. And I think that will have multiple ripple effects on the criminal justice system, on where some of our clients go. So basically the state is supporting these safe option support teams. And they are very rich teams that will be able to serve over 1,000 individuals in the city and probably another 800 upstate as wraparound teams for individuals who are on the streets. And they will be able to work with them, engage with them, stay with them for pretty much as long as they need to, but probably in the range of 9 months to a year, and help them find the services they need. We've done a lot of outreach. I think where we haven't been quite as creative is in making sure the connections last. And I think what these teams can offer for some of those individuals is someone that they connect to, and it can take a while to connect, but then they stay with them. And they stay with them through the transition to transitional housing, and then ultimately maybe to permanent housing. So that's a very exciting initiative. Coupled with that are increased bed rates, so that my Article 28 hospitals don't close, which is what's been going on. And you know, it's fascinating because when we upped the rates for child and adolescent beds, a couple of places opened beds across the state. One big one up in Claxton-Hepburn up in the north. So when the rates are right, we know that the beds can be more stable. So we've definitely also had this 20% increase in the rates for the inpatient beds. On the acute care side, which would be very helpful again, I think, with this population, because some of them need that for a while. But we're setting up a whole system, and then we have the crisis system, which will interface too. So that homeless initiative, the crisis system, I think could really have a significant effect. But the crisis system is for anybody. So those crisis stabilization centers will work with families, youth, adults, and they will work with, you know, a child who maybe isn't going to school, doesn't want to go to school, all the way to someone who maybe is having a psychotic break. So I think we're going to be really having a wide range of services available, which again, I think is tremendously exciting. And then just to highlight a few of the preventive issues that are going on with kids. You know, for a number of years, we've had Healthy Steps, a program that really enabled a mental health practitioner to be in a pediatrician's office, not just to deal with someone who's showing signs of mental illness, but to do all the preventive work that's so important. You know, working with families at risk, if there's suddenly unemployment in the home, if the family's been reacting to the pandemic, if one of the family members is sick, or if the child is ill and maybe has some problems and can't get to school. All those kinds of crises that happen every day in families, that we don't do enough preventive work to prevent anxiety disorders, depression, maternal depression, screening for maternal depression, making sure that we do that. So Healthy Steps will now be able to be part of, embedded, the 59 Healthy Steps programs across the state will be embedded into Medicaid, and we will slowly work to expand those Healthy Steps across the state. And I think that that is really exciting, because that's really primary. When you talk about ACEs and you talk about the things that cause, can be causative of mental illness, this is real primary prevention. This is prevention before something happens. The second big area is our schools. And I think we all know that the work that's being done in the schools, we have money in budget for trauma-informed care. We're going to be further expanding the school-based mental health clinics as much as we can. We have about over 1,000 schools that now have school-based mental health clinics across the state. I mean, that's really kind of cool. When I started in this job, we had like 190. Now we're up to over 1,000, and we want to keep growing them across the state. There's also a lot of preventive work going in with our suicide prevention office, et cetera, in schools. And I always just have to take a minute to thank you guys for what you did. You know, now that it's there, maybe people don't remember, but when you got that Mental Health Education Act passed that said that, you know, there had to be mental health in the curriculum, that was a landmark event. And I've said this to other groups too, but I have to say my grandkids, the love of my life, and thank you for mentioning my grandkids, Bill, you know, they come home with homework based on social emotional learning in their public school system in New York City. So I'm telling you guys, the reach is happening. It's happening. And they, you know, it's really cute because I look and I go, oh my goodness. I mean, I wouldn't have thought of that 5, 6, 7 years ago. It wouldn't have been happening, but it's happening now. So just when you get something like that through, it has an impact that goes on and on and on. So I know just a couple of other things about kids. One is the home-based crisis intervention, which I know people felt was really very helpful as a state program, is going to be doubled. So it's now serving about 1,300 families. It's going to serve 2,600 families statewide. That was a big add-on to the budget. And I think also gives us, and then we're also opening up 20 ACT teams across the state for youth. So we're building the infrastructure for the intensity for youth as well. And the CFTSS will go forward with the rate increase. We're hoping we can keep that rate increase going. We're working on that. We should be able to. It's certainly going to be there for several years. And we're going to continue pushing that out. So I think that we're also building an infrastructure and capacity to do some really good work. And then lastly, just one quick word about peers. I think with the new rehab model for clinics that was passed by that we got through the feds, peer services can now be billable in clinics. And so we're looking for a massive expansion here, hopefully, of peer services to be used well in the clinic system. We also have some dollars in the block grant that we're using towards peer certification and peer academy, other kinds of things to grow the peer workforce and to really make sure that we have peers well certified and really embracing them throughout our workforce is another big piece of the initiative. So I think I've gone quickly through a lot of the things, but I don't think I've ever had the experience of reporting quite so many good things that are happening. So it's really a pleasure to do that. It's always a pleasure to just see all of you, to again, thank all of you for what you do. And just please know that your voice is so, so important and that you are heard, that your voice over the years has been heard. So keep up the advocacy, keep up saying what's important. And I think this year, a lot of what you wanted has happened, but there's a lot more. So keep that voice going. And thank you so much for all you do. Thank you, Glenn. And thank you, Bill.
Thank you so much, Commissioner. We're so lucky to have you as our, as our State Office of Mental Health Commissioner. We really are honored. And, you can tell by the passion. And again, you talked about the issues. Those are the issues you framed are issues that are so germane to us. Every one of those issues you mentioned is so germane to the work that our members do around the state, the work that we do at the state level as well, in terms of our advocacy. And we're continuing earlier today, we had the discussion about some of our other continued priorities. Of course, as you said, there's never enough. Yes, this is a great year. We've not had a year like this, but that said, in relation to what's happened in the past, this is going to start. We're hoping that this year, working with the legislature and again, with the executive and division budget and OMH, that we will continue to get even additional funding for this year. So we are excited about the possibilities of that as well. But thank you for your leadership and thank you for the prioritization of the funding. It really is significant. And I just really want, there's several places where we could laud the work of you and your team, but one of those is the school-based mental health pieces that, I know talking about that. People don't realize that that's tremendous that you had less than 200 when you started. Now we're over at 1,000. And, school-based mental health is so integral to success. You referenced the work that we did, back in 2018. And I think that is so important to recognize. And we've tried to sort of as we've gone into schools and over the last several years and working with you and working with SED is to sort of take a responsible approach around not just mental illness, about wellness and having those discussions. And I think we're trying to normalize mental health, but at the same time, we're trying to have these discussions to really change school environments to make them mentally well for individuals. We're not just identifying, oh, there's the 1 in 5 or anything like that. This is a much broader discussion. So we thank you for your leadership in that arena. Thank you so much.
Thank you. Thank you. And schools, I just have to say, schools are so critical. And I think the environment of the school and the experience a youth has going through schools is just so critical. And I think the work you guys do to push that and to make sure that there's attention to that social, emotional wellness, whatever you say, is so important. So thank you for that. Thank you. Thank you.
Thank you. Thank you. And I also want to acknowledge, you know, our wonderful, the person who started this whole notion within MHANYS was Sylvia Lask. And Sylvia is no longer with us, but Sylvia was an incredible advocate in so many different ways. She was a larger-than-life person. I thought she'd live forever. She's larger-than-life personality, and she was the one who sat down with John and I originally and said, we have to do something about schools and suicide prevention. And that's how it all started. So we miss you, Sylvia, but you're still with us. So I just want to acknowledge her leadership. So thank you. Thank you very much.